So thank you for that. So I'll let Karen introduce our speaker.
Thank you. Can you hear me?
Yes.
Okay, and I wanted to add Peggy to the list of people who were there to help. Okay. Our next speaker, newly arrived Rotary Peace Fellow, Mexan Mapouka. Dr. Mapouka, a physician from the Central African Republic, will be pursuing a master's in public health at UNC's Gilling School, concentrating in epidemiology. He's also just completed a year at Emory in Atlanta, studying public health policy and management on a Humphrey Fellowship. It's really pretty extraordinary that he's here with us today because he comes from one of the very poorest countries in the world, ranked 188th out of 189 on the UN's Human Development Index. Life expectancy at birth pre-pandemic was 53 years, probably lower now. And the average adult completes only 2.5 years of schooling. And you note that Dr. Mapouka's talk today is in French, which is his third language. Okay, so
thank you, Karen. Thank you, President Pat.
Yes.
Hi, everyone. I'm very humbled to be today to speak about the Central African Republic. I'm gonna give the presentation maybe about between 15 and 20 minutes. So first, I will speak about Central African Republic in general, and I'm gonna give some medical challenges that we've been facing since 2012. And last, I will talk about me and my work back home before I came to the US. So before I head to this presentation, I would like to ask you this simple question. The Central African Republic is Congo. How many of you would say that's true? 1, 2, 3, 4. Okay. So it actually it's different from Congo. Why I ask this question? Because since I've been living in US, many people think that Central African Republic is Congo, which is us. And the second question, which flag do you think is for the Central African Republic?
I can't recognize any. Oh, I say 4.
4. Yes.
I say 3.
3. 2. 3. So it actually is 3. So the flag which has 5 colors, 1, 2, 3, 4, 5 is here. Yeah. So if you look at the map of Africa in general, is very simple to find where the Central African Republic is. And if you want to know exactly how the size of the country is like you look at the US map and if you compare to the US map, it's exactly the same size like Texas.
wow.
Almost the same thing. If you look at here, 623,000 square kilometers, which is almost the same size in Texas. So this country has a tremendous opportunities, and we got our independence in 1960. We have 2 official languages, which are French and Sango, but we have so many dialects as well. And most of the people identify themselves as a Christian, as you can see here. And there's also some other different group of religion. The country, as I say, has many opportunities in terms of wildlife. We have a different wildlife as many countries in Africa, sub-Saharan Africa. And we have a 4 famous park, whose name are Manovo, Gunda, and Felix, and Ananduki within the country. And as you can see in the different pictures that I put on the slide. But as many countries in sub-Saharan Africa, the Sierra has so many challenges. And I put here on the graph here, you can see 2 separate groups. The first group is for the conflict challenges. And you can see here that there is an armed proliferation, gun violence, and refugee program. But on the other side, you will see that we have some problem with the infectious disease like HIV, TB, and malaria and malnutrition as well. And the map right here show you exactly how many refugees are living either within the country or in the neighboring countries. Like in Cameroon is right here, Congo is right here, and this is Chad, and this is South Sudan. And if you ask the question, how long people do live there? The life expectancy is much more better for women than men. In 2017, it was about 55 years old. And this, I put this map here, this graph here to show you exactly how, if you compare the Central African Republic, which is here, everything is red, to different other countries in Africa. And you can see here some really challenges, problems that we've been having, like HIV, and you can see clearly that the conflict, which is right here, has a very high proportion, which is very low compared to other countries. And of course, the studies that has been done in 10 years between 2007 and 2017 show that we have improved our healthcare system on it among the HIV. The rank was 1 in 2007, and then it became 3 in 2017, which is a little bit better. But you can see that the conflict has increased from the rank 30 to 10 in 10 years. And this is another problem about talking about the maternal health and child health care. As many other countries in Africa, we have all of those problems as well. So what was my contribution? So first, I started to work in 2016 as a physician specialist of HIV/TB. So we provided free treatment to people living with HIV who came to the hospital with different complications that you can imagine. And second, I moved between 2017 to 2019. This is me right here. And so we provide healthcare to people injured by weapons. There's a civil war going on since 2012. So a lot of people need help. And then the other programs that we had with the ICRC was to provide water rehabilitation, economic security, and we had a very independent neutrality, humanity way. We did not do politics. We just provide humanitarian service to people affected by the conflict. And then I came to US and I did a little research with the CDC, the Center for Disease Control and Prevention in Atlanta. We work on an HIV project for Sub-Saharan Africa, especially for Cameroon. And we were able to collect some data that we came up with. So I want to share with you how it looks like with the project that we did with CDC. Cameroon data, the data that we collect from Cameroon shows that the HIV incidence was about 0.24%, and the proportion of people living with HIV in Cameroon, the stage was about 55.6%. And among those people, those who were getting the treatment were about 93.1%, and those who developed virus suppression after taking the treatment was about 80.1%. Why this is so important? Because this project, CANFIA, is funded by the US Presidential Fund for HIV/AIDS Relief, the PEPFAR, and it's very better to understand what is the trend of the HIV among different countries in the world. And then I did a research for the COVID vaccine with a company in Georgia before I came here. So where I am now is to complete my master's degree in epidemiology, and I'm going to probably to work in the research area in the humanitarian area when I will return back home in Africa. So I put some references here for you, and thank you so much for your time, and I really appreciate it. Thank you.
Does anybody have any questions?
I saw because of death and saw that the coronavirus has been doing some testing down there. Has there been a big problem with coronavirus in Central African Republic?
Yes, coronavirus is one of the really challenges that we're facing, but the only issue is about collecting data. So people don't really report the real data in the field. because I believe that we have a very weak public health surveillance actually in the country. As you can see, it's not only about CAR. You look at all of those sub-Saharan Africans, they have a very weak public health surveillance. So they don't really report the real data, and it looks like things are not really worse. But if we go deeply and you try to understand, you will find that it's a really worse situation actually, and especially with the Delta variant. So even when I'm studying here, I belong to the National Association of the National Physicians, and we've been checking, getting all of this information that people collect from the ground to see how the trend is going on. And I can tell you is one of the things that we, trying to work on it. So thank you, very good question. Yes.
We had another doctor in who was done a lot of work in Uganda, running into hepatitis B in infants. Is that something that you see in CAR? And then the other question I have is, what's your plan when you finish here?
Thank you. For the first question, hepatitis B is a really one of the public health problems that we have as well. If you look at someone who has a HIV infection, usually they come in the hospital either for the complication, and for the complication, we can find sometimes people living with hepatitis B as well as tuberculosis, meningitis, and all the other infection. So it's one of the public health challenges that we have, but I don't have any data that I can share with you so far. And for the second question, of course, my plan is to work with the national or international organization after we complete my master's degree. So trying to find a place where I can work and provide more, contribution to the public health challenges we be facing.
Yeah, I'm wondering if you could talk a bit about the connection between education, specifically girls' education, and the public health situation in CAR. I mean, I know that public health infrastructure is very, very weak, and will need to depend upon people who have paramedical training, who aren't full doctors and fully medically trained. But you can't reach the women and the girls unless you have women involved in that, and you can't do that unless the women and girls especially are educated. So could you talk a little bit about the connections between education and public health and how you see that developing?
This is a very good question. And I believe that the goal for the next 10 years or the next 50 years is to get more women educated, which is very, very important in our society. In the US, you guys have a lot of progress. We have made a lot of progress, but in Sierra, we still have those challenges, and especially in certain community where you can go, it's very easier if it's a woman who does the job than a man, and it's something that I think is actually even, it's like a new thing that people try to do now, and to make sure that the education of women has a very important place in the policy or in the government project that they have. And unfortunately, there's still more challenges. And, and we've been dealing sometimes with corruption and different stuff that, that are considered as a barrier to get things better, and that we can get a better education connected to the healthcare. But in the school when I was studying, I had at least 15% of the students were women, and which was very good, 15%. And after we graduated, it was about 10 or 11% like this. So I think it's something that is coming up. Yeah, we're still working on it.
And notice the population was a little over 4 million. Do you have any idea how many physicians there are for that population?
This is another good question. The physician density, I don't know how they call it, but you find one physician for 100,000 population here. One physician. Let's see. I'm not really sure about the data, but it's very, very low if you compare to other countries in sub-Saharan Africa. Yes.
Did you go to medical school there in CAR, or
Yes.
is there a medical school in the country, or do most of the students go outside of the country?
Yes, so I graduated back home in Central African Republic as a primary care physician. And then if you want to get yourself specialized, like I'm going to do at the UNC, you need to go somewhere outside the country to continue. Yeah, we don't have a school, we call it the School of Specialization. We don't have it yet.
Could you tell us a little bit about your growing up and how you made the decision to become a doctor, and what obstacles you had to overcome to get that education?
Yeah, thank you. So the first reason was about when I was 3, my mother passed away. And the reason why she passed away because she went to the hospital to give birth to a child who was supposed to come after me. And my father had been talking to me about that it's very important that you do something in her memory. And that's why I decided to become a doctor, first of all. And the second reason, because of the challenges we have in Sierra, a lot of people are suffering, and I thought that it is very important that I can contribute to help people to serve my community and do something better. And I was even decided just to stay as a physician, as a clinical practitioner. But I said, well, that would be better if I do something for the mass population, like a public health that I'm going to do at the UNC here, instead of focusing on individual healthcare, which doesn't really have a large impact on the population.
Let me just follow up with, how did you pay for your medical education? And how were you chosen to be admitted to your the basic medical education in Central Africa?
Thank you. So the school in Sierra is very affordable. It's not like in the US, it's different, quite different. And we had a scholarship, which I given only for the best student. And I was among the top 5. So I was able to get this, the scholarship that helped me to pay for my education. And I was working in the hospital as well. If you do an internship, you're gonna get a little bit pay so that you can pay for your tuition and living expense. Yes. You're welcome. And also, yeah.
Which international aid agencies or non-governmental programs are most influential in medical care in CAR?
This is a good question. I think if you look at Sierra, we have all of those, the United Nations organization working in the field, but I'm not sure which one has the most experience in the field. Depending on the area, or each of them has different area of innovation. My 2 NGO that I work with when I was in Sierra was mostly for conflict first and for the infectious disease. But if you look at other NGO, they have some innovation in the specific area like maternal healthcare. So depending on a different field that within the healthcare that you have in the country is something that is really diverse. But all of them are working under the United Nations funds. So they get all those fundings to the United Nations organization before they bring it down and spread it out through different programs. Yeah.
How did you identify with the Rotary? How did you become aware of that?
So thank you. When I came in the US, I wasn't able to speak English. I only spoke French, and it was really hard. So I had a better opportunity to study at the University of Montana in Missouri. And I got in touch with the Rotary Club in Missouri, and we did some volunteer work together, and I learned about Rotary, and I find it very interesting, especially for the Peace Fellowship Program, which is for someone who's come from a war country who has experience working with patients. And then I said, well, I talked to my friend, and she said that it's better, you have a better opportunity if you apply, as your goal is to pursue with your education. And then that's why I applied. Yeah.
Okay. Right. I'm from Kenya, and I know we struggle with this. How many major hospitals or referral hospitals do we have in CAR?
So we have two separate groups of hospitals. The first is for all of those public hospitals that you find the university hospital, and you will also find the second group is only for NGO who came to the country to help people. So they don't, well, they have the WHO protocol recommendation, everything when they implement their program, but they're working together as with the government representative of the government organization, the Ministry of Health in the country. So I can tell you in general, there are two separate groups, yes. How many? Well, in the capital, we have at least 5 biggest hospitals, the university hospital, and in the provinces, in each big city in province, we have also at least 1 big hospital.
That's great. Thank you so much.
That was wonderful. Thank you, Mexan. Thank you so much for